Hello, let's talk about the gynecological consultation. What happens when you visit the gynecologist? This can be a little bit overwhelming for some patients, and the aim of me doing this video is to try to ease off that sentiment. The visit to the gynecologist is going to be broken down in two parts. Part 1, where I will talk about the clinical consultation. Part 2, where I will talk about the clinical examination. The conclusion of the visit is going to be summarized on part 2. This is gyne4u.com. I am Mr. Bedoya Ronga, consultant gynecologist. Let's start with the clinical consultation. Please be aware that in NHS hospitals, some trusts do not allow patients to choose between male and female doctors. This could be relevant for you. The clinical consultation will start with the gynecologist greeting you, and several questions will be asked. Commonly, it would start with your present complaint. What is bothering you? What is the reason for the referral? Some of my patients do attend with 3, 4, 5 complaints. These are too many for one single consultation and needs to be broken down in 2 consultations. So it is relevant for you to know which one are the 2 most important, so we can concentrate in discussing and organizing a management plan for those 2 and planning future visits to discuss the rest. Your gynecologist would like to know about your main complaint. How long has been affecting you? How that affects your quality of life? What have you or your GP already done? Have you been seen by the gynecologist previously because of this same similar problem? Other common questions are to get to know about your periods, if they are a problem, how long do they last, if you take contraception, if your smears are up to date, and the previous smear history. Any medical problems? Do you visit your GP for a regular prescription? Do you take any tablets, any medications? Do you have any allergies, any medical allergies? Have you had any surgeries, any operations in the past? We would also like to know your weight and height to calculate your body mass index. Who do you live with? What level of activity can you do on your own? Do you work? Do you smoke? Do you drink alcohol? Is there any family history of cancer? This is the generic structure of a gynecological questions. There will be also specific questions guided towards your main complaint. For example, when there are urinary or incontinence problems, when there are fertility concerns, when there are pain problems, or heavy menstrual bleeding.